Hi, I'm Dr. John Young, the medical director here at Foundational Health Center here in Largo, Florida. And we're going to talk today about probably the most common problem that we see here in our clinic, which is fatigue. Everyone wants a little bit more energy, but in the patients that I see, it's like they really are struggling. It's more than just, I didn't get enough to sleep last night and I'm just kind of worn out. And it's a problem that most of them have been struggling with for years. And I want to share with you some very simple things that I think most doctors miss and can make a huge difference when it comes to getting over this fatigue that people have. One of the first things I want to remind people is this. When you get your blood work, these are ranges that these ranges of normal can be from 2 to 4, let's say with thyroid. And so the thing to remember is each of us are unique. And you may come in on your thyroid at 2.1 and the doctor says you're fine. Well, you may not be fine. You may be one of those people that you need more thyroid, maybe 4.0, 3.8 or whatever, before you really wake up. So in looking at your lab work, when you look at the levels that your doctors are ordering, just because you're just into the normal does not mean it may be normal for you. So as I've just mentioned about thyroid, most doctors miss getting the actual thyroid hormone, which is free T3. Everyone gets free T4, TSH, and that's great. I use those. But free T3 is the actual thyroid hormone. And the thing you want to find out is this: where on that bell curve of 2 to 4, or whatever the ranges are, do you fit best? And if a person is telling me, John, I'm on a little bit of thyroid, but 2, 3, 4 o'clock in the afternoon, I would die for a bed. Well, free T3 runs out about that time of day. So I would go up on my levels, go up on my dosage on my drug. Because what we are forgetting is we need to treat the individual. And just because you're a point into normal does not mean that's normal for you. So talk to your doctor, and maybe you need to go up higher on your dosages. The adrenals. If the adrenals don't work right, the thyroid probably is not going to work right. And it's called DHEA sulfate. Easy lab test. And most doctors really don't get it. But that is the first step in making energy in the body, is the adrenal glands. And most of my patients, I hate to tell you, who are fighting fatigue, their adrenals are just kind of worn out. If you're under chronic stress, just been sick for a long time, the adrenals start to wear out. So DHEA sulfate, you can get any health food store. I use that 5 to 10 milligram dose. There are higher doses, but it can give some elderly people some palpitations. So just a little bit of word of caution there. But look at that adrenal gland, and you may need a little more support adrenal-wise. Another marker that I see that doctors miss is ferritin. I had a lady come in the other day who's been complaining of fatigue for years. She's about 32 years of age. And she had her old blood work, and she brought it in, excuse me, and the doctor had gotten her ferritin level. And the range in her lab was, I think, 12 to 288. Her level was 4. Now, ferritin sits on the red blood cell and allows you to hold on to more oxygen on that red blood cell. If you don't have a lot of ferritin, you can't hold on to much oxygen. You're kind of running around hypoxic, low oxygen level in your whole body, which would wear anybody out. Well, her level was 4. And I looked at the lower conjunctiva of the eye, just pull it down, look in the mirror, and hers was kind of pale red. You want it nice and bright red. And that's kind of a poor man's version of looking at how good your ferritin level is. And I said, did your doctor say anything about your low level? Oh, she said everything was fine. Don't worry about it. You're kidding me. So we gave her an IV, we do IVs in the office all the time, of ferritin with a little bit of IV vitamin C so it's better absorbed. An hour and a half later, completely different person. Completely different person. I think the ferritin levels need to be up around 60, 80, maybe even 100 for people to really work well. But look at that ferritin level, and if it's low, even in the 20s, 30s, that may be too low for you. You may need IVs of ferritin. You can do it pill-wise by taking iron pills, but it may take about 6 months to get there, not 6 weeks, 6 months to get there. It's a long time because iron is hard to absorb through the GI tract. So also remember, if you're losing hair, it can be a thyroid problem, but it can also be a ferritin problem. Dermatologists have told me that you need a ferritin level of about 80 or 90 just to grow hair. Another common mistake that a lot of doctors miss when they're dealing with fatigue is vitamin D, as in dog. In the first step in the mitochondria, which is the battery pack in the cells, it's a 5-step process. That first step uses a tremendous amount of vitamin D to get it going, to make energy. I am shocked at the number of patients who come in with low vitamin D levels, let's say under 40. I give them a shot of vitamin D, it's like, John, I feel great. Remember, vitamin D levels, just because you're at 30, which is the lab marker, it just means you're not going to have rickets. You need it over 60 if you're going to just have cancer protection. I like higher vitamin D levels. Vitamin D, if it's low, it's going to be very difficult for you to make energy. Another thing that I can look at with patients is B12 levels. Unfortunately, the B12 levels that we have access to through the labs just tells you how much B12 is in the blood itself, not in the actual red blood cell, which really makes the difference. So I don't get too many B12 levels. I have no problem giving people a shot of B12. And if they say, I feel great, then I will supplement them with B12. I usually don't use cyanocobalamin, which is what most doctors use, because a lot of my patients have a MTHFR problem, so they need methylcobalamin. If that doesn't work, I can give them adenosine hydroxycobalamin, and that may help. But there's 3 types of vitamin B12, and you could just try the easy one, cyano, methyl, adenosine hydroxy. So that's something to look at when you're looking at fatigue. And then you can get into other areas like chronic Epstein-Barr virus, chronic CMV, cytomegalovirus virus. These are problems that these are viruses you contract through your life, and they can cause chronic fatigue. The treatment for that, you can do intravenous vitamin C, and it just kind of, I think, helps. But if you actually want to get rid of the virus, we have that ability to actually send the blood off to Europe. They grow it out, they make a so-called vaccine in the loose sense of the word, and they can actually wipe out the virus completely. So you've got cheap things to do, very expensive things to do, but there are a lot of inexpensive things to do that I find people are going around in this zombie-like state, and it's cheap and easy, and so many doctors are not checking these basic things, and it's just really sad to see people who have been just worn out for years, and it's just a quick fix, be it vitamin B12, D, ferritin, thyroid, adrenals. So when you're going through your labs or having your doctor order labs, realize that you may work better at the higher end of some of these ranges that you get. I hope this is helpful, and we'll be talking to you soon.